Hi, I'm Tamara Thomas, content editor for Urban Health Today, and I'm speaking with Dr. Spandana Nallapati, a board-certified developmental-behavioral pediatrician who works with families of children with special needs in Greenville, Jersey City, and New Jersey. She's a graduate of Ross University Medical School and completed her pediatric residency at Brookdale Hospital in Brooklyn, New York. So we're going to be speaking today about the impact of COVID-19 induced isolation and remote education and its effects on children. Um, let's begin. So the first question I wanted to ask is, what behaviors have you seen in children resulting from the pandemic shutdown and switch to online learning?
You know, when the pandemic first began, I think that um, there was a bit of a mixed bag of how children dealt with it and their families dealt with it. And again, my expertise is more with children and families that have some sort of a special need, whether that's as simple or as singular as a speech delay or something as complex as autism or ADHD or a learning disability. But it was across the board clear to me that there are some children, whether it had to do with their diagnosis or their temperament, that managed this better. They actually thrived. They used to be bullied in school, so they were no longer bullied. They used to not receive the resources and help that they needed in school because of overcrowding or because of lack of resources at the school, which all of a sudden now they were receiving one-on-one help at home and a lot more attention, and so they thrived. But then there were, I would say, a majority of my patients who really struggled, whether it was from a change in routine, whether it was from the sheer fact of that they didn't have a second bedroom to stay in to do their homework, so everybody was working from home and everybody was going to school all in one room, or they didn't have the one-to-one aid anymore that they needed to succeed in school. So all of these resources being taken away, this change in routine, and this sort of jarring change that happened what felt like overnight to them, they really, really did not do well. As the pandemic went on, I feel that the percentage of kids who were thriving, who were doing really, really well, decreased, and the percentage of kids who were really struggling, whether it was because of lack of academic supports or lack of home supports when it came to just living day-to-day life, or just an increased amount of anxiety and stress due to uncertainty, that percentage became much, much bigger, where my conversation switched less from, what services is he getting? Is he doing okay? To, did he sleep last night? Is he still having nightmares? Is he refusing to even go to the backyard anymore? Is she throwing more tantrums? Things like that. So I think that in some ways, both kids and adults and parents are reaching their limits of this pandemic.
And specifically speaking, are you seeing the same things in younger children vis-a-vis older children, or are you seeing different things?
It's a really good question. There was a lot of research, and there is still a lot of research that is coming out from both more hard-hit areas originally, like China, and both the US and other places that have been hit a little bit later on with this pandemic, on children and how they're dealing with anxiety and how much of their mental health has been disturbed by the pandemic. And it's really interesting because a lot of them don't break down the age groups. How a 5-year-old manages stress is very different than a 15-year-old, but they're both technically children.
Right.
So it's difficult when somebody says children, because I think it always needs to be in context. And to answer your question, younger children definitely had increased levels of oppositional defiant behavior and defiant behavior, but it was more out of frustration. It was more because of a lack of understanding of why they couldn't go outside, why they didn't have to, they couldn't see their schools. But the younger the child, I felt that the better the coping was in the beginning, because they got to stay home. They don't want to go to school. They missed their friends, but they weren't as it is appropriate for a child's developmental stage. it wasn't all about their peers yet. There is a certain age where it flips from being about themselves and about their parents to it being about their peers, and which is about early adolescence. So anything you see before that, I feel that they were able to cope a little bit better because they loved being home. It was great. They got all the time with their parents they never received. They had one-to-one attention that they'd never received before. But adolescents definitely struggled starting early on because they knew the immediate impact, and they also had a much deeper understanding of the global issue that was happening, not just with the pandemic in the US, but what was happening overseas. And I believe, especially as you get to middle and late adolescence, they have a much more understanding of the abstract. They have a much more deeper understanding of the colossal effect that this will have on humanity, and it affected them much stronger much earlier. And so you did see a lot of withdrawal, you did see a lot of anxiety, you did see a lot of a realization that this is not just a vacation from school.
Mm. Hmm. I can tell you though, my 4-year-old at first, speaking of the coping, at first she was very happy. And then as it dragged on, it was like, will I ever go back to school? I don't like this computer school. So, as a provider who works in urban healthcare settings, can you talk about disparities resulting from these changes to the way children are now living and learning?
So for children who are living in urban environments, even before the pandemic, there didn't need to be a pandemic to know that children who grew up in somewhere like Greenville, Jersey City, did not have the sort of resources that other kids might have growing up in different parts of, even New Jersey. It meant less resources for mental health support services. It meant less resources for school, tighter budgets in school, which meant less staffing, which eventually ended up being more, resulting in more crowded classrooms, etc. And we could go on forever. But then the pandemic hit, and I think that it just blew up the problem even more. So now we had, for example, in Greenville, New Jersey, in Greenville, Jersey City Medical Center was one of the biggest hubs, not the only hub, but one of the biggest hubs of youth mental health services. Now you have an increasing amount of children having mental health issues, but you have one hospital who's trying to deal with it all, one department that's really trying to deal with it all, who can't come into the house, who can't have the patient come in. And they're trying to figure out how to do virtual therapy really quickly, behavioral therapy, not just with an adult, a neurotypical adult who says, talk to me about your feelings, and they're able to, like this. Now you have children who needed one-on-one help with behavior such as biting, kicking, or they needed speech therapy, and that's what they were getting, or they needed help with their pyromania or their aggressive behavior. And now you're trying to figure out how to do this, but then at the same time you have the numbers are increasing way faster than they were before the pandemic, and you just have this one place, this one main hub. And I think it showed these disparities to even more clear picture of what is really lacking in urban environments. And another big disparity was schools. When we have a school that is already strapped for budget, when we have teachers having to share things, aides, there not being enough aides to support the kids who need one-on-one aides, and now all of a sudden you have all of these kids at home and you don't have a structure in place on how to support this kid with speech delays, and this kid with one-on-one help with ADHD, and this kid with a learning disability who needed a 12 to 1 to 1 classroom. And it was difficult or even poor in some schools to begin with, and now it's just you just have to do it even more. Another big thing is parents who were essential workers, or parents who didn't speak English, or the parents who simply didn't even have the physical room. You have a family living in a one-bedroom apartment. We don't have the father who can go into the room, the kid who can go into the other room to have his classroom setting done. So all of these things I feel were just put under a magnifying glass
And
when the
probably not
pandemic
enough
hit.
equipment. Not everyone has multiple, if any,
If
laptops
any,
or
I had a
computers,
lot
right?
of parents who missed, a lot of kids who missed sometimes weeks of schooling
Wow.
because the school had to send out the laptop, or they had to go pick up the laptop, but they had to take public transportation to get to the laptop, which they couldn't do because of the pandemic. And
Mm.
so, and they had to work. And then you finally get this laptop. You don't know how to use it. You may not be comfortable with computers. You may not speak English at all. And you have to leave for work. And you have a
That's a
7-year-old.
backfire. Mhm.
You know, it just adds up and adds up and adds up. And my follow-ups turned from being more clinical to being a little bit clinical, but also just trying to figure out, okay, I can't make him log in. He doesn't want to log in, but I don't know how to log in. Or if he gets stuck and he asks me a question, I can't answer it. I don't know English and I don't know math, or I don't know, you know, or I'm not home because I have to go into work.
Hmm.
So it really shined a big bright lamp onto these issues for sure.
So will we see any achievement gaps from resulting from this?
From my experience, especially with kids with special needs, whether that's learning disabilities or ADHD or autism, I feel that there's going to be pretty big achievement gaps when it comes to kids who are in these urban environments, who had these urban disparities show up, that they had to battle in order to even get to the basic level of education that other kids who didn't have these issues are going through. And add on to it, if you were a kid with speech delay and you didn't get speech therapy because they couldn't figure out for months how to get you speech therapy virtually, and even then teaching, having a kid go through occupational therapy at home while the occupational therapist is at school is not the same. It's absolutely
Right.
not the same, and in a lot of cases it just was a complete failure. So now you have children who are regressing in speech and fine motor skills. You have kids who are regressing in behavior. You have kids who just refuse to log into school because because of their diagnosis, or because they just didn't want to, and their parents didn't have the option of staying home with them and making them do it. And as far as I know, none of my families that I spoke with, kids, nobody failed. And so now you have these kids going on to the next grade
Social promotion.
who had months of practically learning nothing. I had some schools say, "Oh, he's refusing to log in. Oh, you're not showing up. Okay, we're going to send you a package home, and you just do the package with them." And the parent is like, "When am I supposed to do this package with them? How am I supposed to do this package with them?" Um, and so they just don't do it, but they passed anyway. So now you have, and then you have other kids who had the one-to-one help, had all the resources they could possibly have, and who are absolutely caught up. So I think that if not this September, because this sort of continued into this year, I think next September we're really going to start to see these huge gaps.
Hmm.
If one There is one thing I've heard over and over and over again from my special needs parents, kids with special needs, their parents, is no one's asking us. No one's asking what I need for my child. My child was in a classroom of 5, and he had a one-to-one aide, and he's either intellectually disabled, or he's autistic, or he's he has Down syndrome, or he has this, and he had all of these resources, and the school is making this plan for him, but nobody's asking me. Nobody's asking the experts on the children what to do with the children.
Yeah.
And I think that if they had, you know, ideas like mine, because the parents had these great pod ideas, If they were asked by the school, they would have just told them, hey, listen, I've got a home in this neighborhood, and why don't we put together 5 kids around here and put them together as a pod?
Let's unpack that thought of getting feedback, if you don't mind,
Mm-hmm.
from the parents and the providers. So, what would that look like from the school? Would that be surveys? How would they do that?
When they were trying to decide who was coming back full-time, part-time, or home, I heard a lot. Every parent of mine said they sent me a survey. They called me and they asked me what I preferred, if they wanted to send my kid back full-time or if I wanted to keep him half the time. And I thought that was really cool. But I also, it was so unique because it was the only time they were reached out to. And when they were reached out, parents had a lot to say. And I did have one or two schools whose parent, the parents said, it's so wonderful that the social worker checks in on me every day. The therapist checks in on us once a week. This and that and the other is they're calling and they're checking up on the parents to make sure that they have the resources they need for their parents, for their kids, mostly because those kids were very high needs. They were syndromic, or they were very low functioning, and they had a lot of comorbid conditions that needed a lot of help. So they already had sort of a caseworker and a social worker and stuff. But if you completely back that into a typical neurotypical classroom or whatever, it could be by surveys, it could be by phone calls. Every teacher has their pod of students. And if they have parent teacher nights, why not just have parent teacher Zoom nights before you make the decision for that classroom? In a learning, if a child has a learning disability, they are sometimes placed into a special education classroom, which is slightly smaller than a mainstream classroom with 1 or 2 aides in addition to the teacher. That means that everybody there needed help. So you just talk to those parents. You
Hmm.
don't need to talk to the entirety of the school. The teacher knows her kids better than anybody else. And she or he knows the parents of those kids better than anybody else. So you don't need to do this huge one size fits all survey. You could just have a conversation, have a meeting for 1 hour at the beginning of the week or the end of the week with the parents and say, hey, listen, what can we do? How can we tweak their IEP to still have this? Is the speech therapy working virtually? If the parents are like, no, because this and the other, you know it can be adjusted. I think conversation is a very scary word when you get a bunch of parents together.
Right.
I can understand that, but they're the experts, and you have to be brave enough to say, we need to set up a meeting even if it's a bit chaotic.
What's IEP? For the people listening who don't know what that
I
means.
apologize. So an
Oh,
IEP stands for Individualized Educational Plan. When a child has any level of cognitive issue or a learning disability, an IEP is put in place to outline the services that the child will be getting, whether that is how many times a week they get speech therapy, what kind of classroom they're in. It is a document that outlines what the plan for the school is for that child for that year, um, on the services that they need.
ah. In your article about remote learning and the learning disabled, you use the term neurodiverse. What does that mean? Can you talk about that?
On a very basic level, it means it describes the ones of us that think a little differently, that may come at a problem from a different angle. And originally, it was actually coined to include anybody with ADHD, a learning disability, a autism diagnosis, anybody who thinks differently. And the idea was to champion the way they think, because the way, for example, an ADHD child might come at a problem might be very different from a child who doesn't have ADHD, but that doesn't mean that they were wrong. And sometimes it's even a better approach. Autistic children are incredibly good visual spatial learners. And that's why they're very good at puzzles. And they might look at a problem and come at it from a completely unique way than a neurotypical child will. Now, that is the idea. So that is the term that was coined. These days, it is mostly used for in the context of autistic individuals. So when you say a neurodiverse, let's say a neurodiverse program, it usually is in the context of mostly just autistic individuals. And it is used as a better term to show that autistic individuals may think differently, but it doesn't mean that it's the wrong way. Or more importantly, that it needs to be fixed, that they need to be brought to the way that everybody else thinks. And um, it's a term to use to champion somebody and to lift them up.
You talked about a little bit about special needs, so let's dive into that. The pandemic lockdown, are you finding that it's having a different effect on these children versus children who are not special needs?
Absolutely. And I think we've touched on a few topics already, especially when it comes to services. If your child has absolutely no delays, no diagnoses, it's completely what is the term is neurotypical,
Mm-hmm.
uh, then you have, I wouldn't say an easier time, but you do have a little bit of a more straightforward path. It is what the school's prepared for. I have two nieces. One is 10 and one is 7. And, one is a bit of an introvert. One is a very much of an extrovert. So have they struggled through this? The extrovert definitely has. The introvert keeps sort of saying, can we continue this forever? I'm loving this. And so, but they're both bored. They're both, they're, they both struggle on their own level, but academically they are thriving. They finish their homework before, everybody, and they have their own space, and they can get all their work done with no extra help. They don't need any tutoring. They fly through everything. But and not even to use the word special needs, anybody with any little bit of a need, anybody who's struggling,
That's good
yes,
to
if you
know.
have the diagnosis of, let's say, for example, dyslexia, which is an example of a learning disability, yeah, you needed a lot of extra assistance to make sure that you succeeded the way that every other kid succeeded who didn't have a learning disability. And I think, like I mentioned before, the original sort of emergency plan that schools came up with completely did not take kids with special needs or of any needs into account. They went for like my nieces. They were for kids like my nieces who could just sit at home and get their work done, who needed maybe a little bit of a focusing, but
Mhm.
that was it. Anybody who needed anything more on any level, in a way, was just kind of put on hold. We don't have an option. We don't have a solution yet. Just kind of hold on for us, is basically what the schools unofficially said. Some of them started to receive some version of the support. They were never really adequate, especially in the urban communities that I saw, because those services were barely there to begin with. So kids with special needs or any needs really were thought of as a second, in the second wave of thoughts, in the second wave of planning. And even then, I had a lot of kids whose speech therapy was just never restarted. They said, oh, we'll just have to think about it in September.
I was thinking more along the lines of, are you seeing different or enhanced behaviors from?
Oh, absolutely. Oh, I apologize. Yes,
No, no, it's okay. I wasn't
absolutely.
there.
I think that, it is different on depending on the temperament of the child, the age of the child, and the diagnosis the child has. So for example, if you have somebody with ADHD who, maybe at first thrived a little bit because they had one-to-one attention, you're starting to see more oppositional and defiant behavior, mostly because of their ADHD. Their energy isn't being spent. So they're not sleeping well because the motor is still running at 60 miles an hour. Usually that some of that would have been spent in school or after school activities, karate, track, basketball, and now it's nothing. It's video games, it's school, which is on the computer, and you don't have anywhere to expend that energy. So now you're staying up all night. Now you're getting into fights with your parents more often. And now you're getting more anxiety because of all the news that you're watching because you have access to a phone or the TV's on all day. And children with ADHD, children with, autistic children, all of them are at a higher risk for comorbidities such as anxiety, depression, oppositional behavior. And you are kind of opening up all of these opportunities for these comorbid conditions to come up more because you're creating this box of lack of socialization, change in routine, which can be quite devastating for a lot of autistic kids because that is part of the autism is the need for routine, the need for the same. And now all of a sudden you take it out completely. And I had very much increased behavioral issues when it came to that. you know um, Something quote as simple as a dyslexia, let's say. And you think it's dyslexia, it's, but you have this kid who finally was getting help for their reading disability, who all of a sudden isn't. And now they're failing. And now they're frustrated and they're more oppositional. They're not paying attention in school. They're zoning out. They're refusing to log in. And now you all of a sudden have a behavioral child when you didn't have any issues before because you were helping them with the one thing that frustrated them. So I do think that there's been a huge spike in behavioral and mental health issues in kids with special needs during this pandemic.
Let me tell you, my little one, she's neurotypical, right? She's neurotypical.
Mm-hmm.
But I have to say that, through this entire thing, before she started back, with in-person school, she had a huge amount of anxiety. I mean, she she followed me around everywhere, like she never wanted to be alone, and she didn't even want to sleep in her own bed.
Mm-hmm.
She wanted to sleep with me every night. Everything frightened her. And she was just so anxious the entire time. It's not until she started back, school, that everything sort of leveled out and went back to normal. But my goodness, she was filled with so much. I mean, it was just incredible that I just wanted to hug her every second of every day and try to make it better. So what behaviors should parents, what's okay, and then what's normal given the abnormal circumstances, and what behavior should parents seek professional help for?
Absolutely. And I think you gave a very, very good example of what any kid is going through right now. I had a family whose mom wasn't eventually she was negative for COVID, but had a lot of symptoms, and so she had to
Mm,
self-isolate.
mm,
And she was breastfeeding at the time, but
mm,
she had a toddler also, and so she locked herself up in the basement with the baby and sort of stayed away from everything. Her husband took care of everything, including the toddler. And I think it was 4 days. And she came up and her test came back negative, and so she just had a cold. And so she said, "That's fine. That's a risk I'm willing to take because I can't be in the basement anymore." But her daughter, and it has now been 2 months, I believe, her daughter still refuses to let go of her side
mm,
because she's so terrified that her mother just disappeared, and she couldn't see her and she couldn't touch her. And she, like you said, she doesn't leave her bed. She used to sleep on her own. She used to play on her own, very extroverted child. Not if she can't see mother. If she
yeah.
can see mommy and she's within holding distance, okay. But now it has become not okay for her to leave the room. And for somebody who started work back up, her Zoom meetings are constantly with a scream and a bob in the background because they can't stop her because she's so anxious, and they can't get angry at her. She's 3, and she's
Yeah,
not doing it on purpose. She's anxious.
right.
So, to your example as well, I think that there is an increased level of anxiety for everybody, especially children, though. And I think that if you start to see the anxiety, there are things that we can talk about and how to reduce the anxiety later on, but it's expected. So if you feel that your kid is being more anxious, it's expected. They're sort of feeding off of what you're feeling as well. they're feeding off of the parent watching news all day as well. So you understand where they're coming. They're most likely having decrease in sleep, which is the other very common thing. Their sleep schedule has been completely destroyed. And I think that those are things that are pretty common and things that you can manage at home pretty well. I think the problems start when and I always use this as a way as if there are more bad days than good days, then we need to do something about it. Whether that's about behavioral medication or any kind of bad behavior, is when it becomes an everyday thing where the tantrums are becoming into aggressive behavior, when the adolescent, is more than just a little mouthy. Teenagers are allowed to be a little mouthy,
Mm.
but when it has become daily fights and you see withdrawal, you see a lack of interest in the adolescent, when you see other signs of depression, that's when you need to seek the help of a professional. In this case, it's going to be your pediatrician. Your pediatrician should be the first stop of all of these things, because they can send you where you need to go. Whether if you need to go to a psychologist, whether maybe, you may need to get admitted because the symptoms are so bad. I had a lot of autistic children who previously had aggressive behaviors, who worsened to the point where they were bruising up their parents every single day. And normally they could call a company called Perform Care, who would send a behaviorist home who would help them manage this every day, but now they can't come to the house. And so, talking to the pediatrician, they were hooked up with somebody who could virtually kind of help calm the kid down every day. So I think that when you start to see that your kids, for example, if you take anxiety, your kids' anxiety has got to a point where they are unable to sleep anymore because they're so terrified to fall asleep, and that's affecting their morning routine, that's affecting their schooling. You need to talk to a pediatrician about it, because it may seem like a small thing. They're just losing a few hours of sleep. They'll catch up with it. It's fine. Over the weekend, they'll sleep. But they're so anxious that they can't come off of that anxiety, even if you've done everything in your power to calm them down and to distract them and to reduce their anxiety. Trust your gut that this is starting to get out of your hand, and it's starting to get to be almost every day, that there's more bad days than good days. Then you need to talk to your pediatrician. They might need just a little bit of melatonin to help them sleep. They might need some anxiety reducing exercises for you to do. They might need something prescription for a short amount of time to sort of help them get over the hump. The adolescent with depression might need emergency therapy, and to be set up with a psychologist and a therapist and a psychiatrist to see what their immediate needs are. So I think that parents are afraid that if they speak up, that somebody might put their kids on pills forever, and I think that's a common and understandable fear. But um, when you start to feel like my kid is out of my control, is when you need to speak with your pediatrician. Out of your control means you've done everything you can possibly think of. You've spoken with your friend, your best friend, you've spoken with your little mom group, and you've done everything possible to either reduce their anxiety, to improve their sleep. You've looked up a good sleep hygiene habits and you've put that all together. You've taken them camping. Your teenager refuses to come out of bed, even when you make their favorite meal. They don't want to hang out with their friends. They don't want to talk with their friends over Zoom. They don't want to hang out with their grandparents. When you've done everything you can and the symptoms have not improved, that's when you
Okay.
need to talk to a pediatrician. That's what I mean by out of control, as in you've run out. There's
Okay.
nothing that you can possibly think of that
All the things within your power to do, you've done, and
you've
those
done.
things don't work. Got it.
Absolutely. But things that need an immediate phone call are definitely more symptoms of depression, and especially in teenagers, in especially now that the world is becoming a little bit more crazier. You are going to see that anxiety level get to a point where you can't bring it back down. They don't want to go sit on the porch even, because they think the air is dangerous or
Mhm.
something like that. So that's when you need to sort of give your pediatrician a quick call. And it's never been easier just to have a phone call, because they'd rather have the phone call with you than do the whole rigmarole of having you come into the office. So you can just quick have a phone call, and the pediatrician can say, you know what, do this and that, and let's talk back in a week. Or, no, I think this is really dangerous, I think let's get a therapist onto the phone as fast as possible.
That,
And I think every parent knows their child better than anybody else. If you look
trust
at
your
your daughter,
trust your instincts.
trust your instincts. I tell that to every parent who has had a frustrating experience either with somebody not hearing them or hearing their help. I said, did you have a gut feeling that something was wrong, that was out of your control? Yeah? Then keep pushing. They say squeaky wheel gets the grease, keep squeaking.
Oh, that's a good point. Yes, you've got to be a strong advocate for your child. Yeah,
You're the
absolutely.
only
Children,
advocate
yeah.
for your child.
Mhm,
Yes,
absolutely.
absolutely.
Well, Dr. Nallapati, thank you so much for your time. This was all really very informative, and I hope this helps a lot of parents with their children get through this difficult time.